Hello, this is Dr. Cieri-Hutcherson. Today we're going to be talking about Transitions of Care Activity 2. So this is the second in our three-part series about transitions of care activities in a hospital setting. So in Transitions of Care Activity 1, you will have seen a patient and performed medication history on them during the beginning of their inpatient stay. And in Transitions of Care Activity 2, the focus will be more on the discharge side of transitions of care. So once the patient's ready to leave the hospital, what are the discharge instructions in terms of their medications that they'll need and the counseling required. So we'll start by going through the class plan. So you should first review which day and time you will be attending. So you'll come to 2:50 at your designated group time in professional dress, so lab coat, name tag, professional clothing, and review the goal of the activity. So the goal of the activity this time will be to evaluate a patient's discharge medication list, address any issues with the list, create an accurate detailed medication adherence tool from that information, and go back in and educate the patient on their new regimen, including a brief review of any new or modified medications so that the patient knows what to take once they leave the hospital. So the way they'll start, there'll be a student-specific schedule posted of what exact time she'll be going into rooms, but you will go into your room in 2:50 and be given a discharge progress note. You can ask the patient in the room any questions and then evaluate their medications and look at the discharge note to determine what medications the patient should be going home on, and then spend a little time, about 30 minutes after that, creating a detailed medication adherence tool. So this makes more sense once we look at some of the examples. So when you look at UB Learns, you'll see a student-specific schedule isn't posted yet, but it will be closer to time. The medication management and care transitions best practices is listed again for your reference. And the first thing we'll look at is, what is the discharge note going to look like that you'll be given? So you can see the example of the discharge note. So this is our patient, BG. His information: he was admitted to Buffalo General Medical Center from the ER with a chief complaint of a burning sensation in his stomach and decreased oral intake because he hasn't been eating. So his serum creatinine was elevated because of that on admission. So you can see his past medical history and corresponding home medications. And then please pay particular attention to their hospital course, because this is going to tell you anything that's changed or new. So for the patient, during the hospital course, it was determined that he was suffering from GERD, and he was started on omeprazole that will be continued. He'll be discharged on it. He'll be discharged on a daily PPI therapy. Also, the patient's digoxin dose was reduced in response to an elevated digoxin level because he had acute kidney injury because of his decreased oral intake, and he should follow up with his primary care provider within 4 weeks for adjustment of the dose. Next, you would look at the discharge medications. So there's a couple things that you want to look at before you start filling out your tool. So was anything new started during the hospital course continued? Were any changes that should have been made? And then were all the other home medications either addressed or continued on discharge? So as you can see, the PPI the patient's supposed to be on for 2 more weeks is listed here. And the digoxin dose was changed from daily to every 48 hours or every other day. All of his other home medications, so atorvastatin, digoxin, multivitamin, loratadine, furosemide, everything was listed here in the discharge medications, the digoxin with just the adjusted dosing time. The only thing in addition to that is heparin sub-Q. So sometimes the inpatient medications that we use are accidentally continued on discharge. So as a pharmacist, you should be evaluating this in addition to other things and the discharge medication list. So was anything new started on discharge? Were any of the changes that were implemented carried through to discharge medications? And then were any of the inpatient medications that should only be as an inpatient, you should make sure that those are stopped. So heparin sub-Q would only be an inpatient medication. This is for DVT prophylaxis while the patient's in the hospital. So that you should make sure that this is not continued. So you would make sure on your list that you wouldn't continue heparin sub-Q. So let's look at what the form looks like. So here's a blank form. This is what you'll be given in class. You won't need to print this out or anything like that. But you can see the times, the medication information and dose, including schedule, and then how many they're going to take each day. So again, I think it's easier to see it once you see an example filled out. So this is a corresponding example to the patient that we just talked about. So BG, you would write your name as the preparing person, the date, and then under time, you would list all the different times the patient might be taking medications each day. So if you only have a patient on 8 a.m. and 8 p.m. medications, you might only have 2 of these filled out. If you have a patient on medications 4 times a day or every 6 hours, you might have 4 of these filled out. And then at the bottom, you would have as needed medications. So every student will be different depending on which discharge note they're given. So you see all his medications, the name, dose, schedule, and then also how many tablets they're going to take each day. So for the omeprazole is new, they take 1 daily for 2 weeks in the morning. You can see that they have 1 for each day for 2 weeks, and then X's grayed out afterwards. If your furosemide being 8 a.m. and 4 p.m., you can see that they take 1 tablet every day at that time and 1 tablet every day at 4 p.m. Next, the multivitamin, they take 1 every day, atorvastatin 1 every day, and then the new digoxin, which is usually taken at bedtime, you can see it's every other day. So 1, not on the 19th, 1, not on the 21st, 1 every other day. Then you can see the as-needed medications, so loratadine, as needed for seasonal allergies, is listed there. But you wouldn't include a number of what to take each day because it's just an as-needed medication. So that corresponds to the example. So if we go back to our class plan to see where we are, you've filled out your medication adherence tool. So you'll have your discharge note and any questions you've asked the patient to find out any changes. And then you'll be going back in and you'll have 15 minutes to educate the patient on these evaluation elements. So if you look at the example discharge note, I've put some example evaluation elements for our example patient. So the first being completion of medication adherence tool. So is anything missing? So you want to make sure that all the home medications were continued, nothing's been omitted unless it should be. So for example, heparin sub-Q should not be continued as this is an inpatient medication, so it should be not on your medication adherence tool. Next, is everything correct? Is anything incorrect? So if there are any changes made during the hospital stay, you would want to make sure that you address those on the medication adherence tool. Were there any formulary substitutions that took place that should be changed back? So formulary substitutions mean that when patients are admitted to the hospital, the patient's hospital only has a certain number of different medications in each class, so they have their own formulary that they prefer. So, for example, for this patient, they might not have atorvastatin that the patient was on at home. They might have a different statin at a similar strength that was substituted while the patient was an inpatient. So if they were changed, for example, to rosuvastatin, they should be changed back to their home medication once they leave because the change was just made based on formulary. So if there are any formulary substitutions that took place or any duplications, those should be addressed and changed back to the home medications. Then make sure, based on the hospital course, that any changes, new medications, or modified medications were implemented. So for example, in this patient, the omeprazole or PPI therapy was started and the digoxin dose was adjusted. Once you have all of those on your form that are being evaluated, you'll also be evaluated on patient education. So I'll show you the rubric for this in just a moment, but basically it's going to be similar to a normal counseling format. You'll introduce yourself and go through the initial counseling points. Then for each continued medication, you'll verify the name, purpose of the drug, and then state to take it the same way. So for example, for this patient, you would say your atorvastatin, which is being used for coronary artery disease, is going to be taken 80 milligrams once daily. Continue taking it the same way as you were before at the hospital. And then for any new or modified medications, you would verify the name and purpose of the drug, how to take it, any side effects, safety, toxicity monitoring parameters, and how to take the medication. So for this patient, you would want to make sure to say you're going to be starting omeprazole, 20 milligrams daily. This purpose of this medication is for your GERD, so once daily in the morning. Explain any side effects, safety, and toxicity monitoring, and you'll be taking this medication for 2 weeks. So you want to do this for any new medications, in this case omeprazole, or any modified medications, so in this case digoxin. So you would say your digoxin, which you're on prior to admission, is going to be changed. So your digoxin for your atrial fibrillation is going to be taken once every 48 hours or once every other day. And side effects are such and such, and you'll be taking this medication indefinitely. So let's just look at the rubric so that you can see what the evaluation will look like. So same initial patient interaction assessments as regular counseling. Again, for continued medications, verified name, purpose, and to continue taking it the same way. Anything new or modified, you would want to verify the name, the purpose, how to take it, safety and toxicity monitoring, and how long to take the medication. There are some additional evaluation elements for communication and professionalism. So let's just look back at our class plan. So you'll have about 5 minutes to look at the discharge progress note, asking questions of the patient. You'll have some time to fill out your medication adherence tool, which will be part of your grade. You can take that tool in to educate your patient. So take in that filled out form and go through the evaluation elements that we just talked about. So you have 15 minutes to do that. So just a bit longer than a normal counseling session to make sure you can address any new or modifications to the medication therapy. And then after that, you'll be evaluated on your counseling of the patient, and you'll be turning your form in when you're done, so that can be graded as well. So make sure you review the class plan before you go. Stop back closer to class, 3:06 or 3:13, for a student-specific schedule so you know exactly what times you're going into the rooms. You can look at some of the examples, the blank form, and the discharge counseling rubric so you know what you'll be evaluated on. Finally, I'll be available by email if you have any questions. If you have any questions the day of, the facilitator is going to be Dr. Waller. Make sure you wear professional clothing and let us know if there are any conflicts that arise. Thank you.